Late Night Health continues. I'm Mark Allen. During Hour 2, we're going to be talking about the Zika virus update with Dr. Dana Cohen and what the Zika virus does. Is it dangerous for everybody? We've been hearing a lot about how it affects women who are pregnant and how to avoid it. And we'll be doing that in Hour 2 here on Late Night Health. Right now, we return to Dr. Sreekant Cherukuri. He is an ENT specialist in Chicago. He is also the creator of hearing aids called MDHearingAid that are much lower in price than traditional ones. All right, let's talk about a couple of things. First of all, there's a hearing test that everybody can take that's free. Doctor, tell us about that.
So, as you alluded to before the break, hearing test is a way to identify if there's hearing loss that even you may not be aware of. Medicare actually recommends a hearing test at everybody's welcome to Medicare physical examination, which might be from someone in their mid-60s. However, studies have shown that less than 15% of primary care physicians actually screen for hearing. So even though it's required and suggested, it is often neglected because there's so many other problems of more pressing nature, such as blood pressure or cholesterol.
But at the same time, hearing is important. To me, it's as important as blood pressure because, well, maybe because of what I do for a living, talking to people, and I need to hear. But at the same time, going and getting a hearing test, it can make you feel real old, doctor. Can it?
You know what? I will say that, we've been conditioned from a young age to see the dentist once or twice a year, and we're pretty good about that. The hearing, though, now with this latest data about its link to Alzheimer's and other dementia, I mean, the most important thing, I think, as we get older is quality of life. And if I could tell you a simple test and a simple intervention could help maximize quality of life for the senior years, I don't think that would be something that people would be opposed to.
And there's a website for that. We should give that out.
Yeah. So normally hearing tests are done in an office, such as a doctor's office or a hearing doctor's office. For people that may be reluctant or geographically limited, we, MDHearingAid, we have partnered with the National Hearing Test, which is the only scientifically validated telephone hearing test in America. And it's normally $5, but for our listeners, it is free if they go to mdhearingaid.com/hearing test. And that is an excellent hearing screening, which can tell you if you have normal hearing or you should follow up with a formal hearing test. And again, if we can identify hearing loss earlier and earlier, we can maximize our quality of life, our independence, and hopefully stave off any kinds of dementia.
It would seem to me also that younger people in their, say, 40s, 50s, even their 60s, getting hearing aids at that age rather than waiting until they're in their late 70s or early 80s, it would help them in a number of ways. They get used to the technology. They can hear better, and as you've already stated, stem any dementia or Alzheimer's that may develop from being isolated.
That's correct, and certainly for our younger patients and listeners, hearing loss has been shown to negatively impact your performance on your job. It affects your income because you may not seem as sharp at work, and you may be passed over for promotions, or you may be unemployed. You can imagine if you didn't have 20/20 vision, you would probably not go to a job interview till you got that fixed. But hearing less acutely can have the same impact in terms of team meetings and things like that. So it certainly has an impact on the job for people that are working. And we know, unfortunately, many seniors are working into older and older age due to the economy. Secondly, we know there's
another reason that they work. They should continue working, and that is that a lot of people say, "I'm going to retire and go fishing," and 2 weeks later they drop dead because they're bored. So
that's true. Keeping the brain sharp,
yes,
is
absolutely,
been shown to help a lot in our overall health. A second area it can help younger people is in interpersonal relationships or marriages. If you're not yelling at each other, certainly the harmony will be much better in the home.
Absolutely, that makes sense. Briefly, in our minute or so that remains to our time, what is that link between Alzheimer's and hearing loss?
So as we alluded to earlier, the brain is similar to other parts of the body where you use it or lose it. And when it's not being stimulated by constant sounds, it loses its ability to interpret those sounds. What we have noticed is in people with even mild hearing loss in medical studies, they had a double the risk of developing dementia in the next 5 to 10 years. And severe hearing loss was 5 times the risk. And so those are seriously troubling numbers when the intervention is so easy. You can take the test on our website, www.mdhearingaid.com/hearing test. Go to an audiologist or an ENT physician, and you can get hearing aids that will really help keep the brain sharp and avoid any loss of quality of life.
Doctor, will you come back in a few weeks and talk about hearing aids?
It would be my pleasure.
I would like to do that because they are so expensive. Dr. Cherukuri has been our guest. Thank you, sir. MDHearingAid.com/hearing test, and he will be back in a few weeks. All right, I'm Mark Allen. Join us at latenighthealth.com, latenighthealth.com. More coming up. Don't go away as Late Night Health continues.
The show continues in a moment.